Okay, good afternoon, everybody. It is now 2 o'clock, so we can begin this meeting of the Health and Wellbeing Board. It is the 10th of April, so we definitely know we're in the right place. We'll start with apologies for absence. Okay, yeah. Anybody else? Do we know of any other apologies? Not aware of any. Okay, urgent matters. I don't believe I have any. Any declarations of interest? There aren't any matters to be considered in private, as far as I could tell. Minutes from the previous meeting. Having not been there, I can't give you an assurance that they are an accurate record, so I look to everybody else and ask if they're agreed. Fantastic. So we go now to item number 6, the integrated neighbourhood teams. Who's leading on this? We can move to a different agenda item and then perhaps come back to that one. Okay, so item number 7, 20-minute neighbourhoods. I think Mandar, you're leading us through this, aren't you? And Jen.
Hi, thank you. So I'm Jen Peters, Assistant Director of Planning, Design and Sustainability at the Council, and
I'm Mandar Puranik, Head of Regeneration, Investment and Jobs.
And we just want to talk you through the new document that came out a few weeks ago now, which is our 7 towns and guidance on 20-minute neighbourhoods in Ealing. Move to the next slide. So what we're trying to do here is look at our neighbourhoods and make sure that we're kind of looking at the economies of those towns, improving connections, including improving health, improving the access to amenities, open space, all the things you need to have a good life, and make sure that they're available and accessible within 20 minutes of our towns. And that also helps us tackle climate change. Next slide. So this is just the kind of forward from the document, setting out why it's important to us, and it's also, it helps create community. It's linked to our Connected Communities agenda, and also it helps vitality and vibrancy within our high streets and our town centres, because people are encouraged to use their local amenities, particularly where there's more opportunity and choice. Next slide. So this is particularly relevant to this group, I think, because we're looking at it crosses a whole host of areas. It looks at health and well-being, it looks at climate and sustainability, and equality and equity. And we, in doing this work, which Manda will sort of talk about exactly how we did it, but we took on board the Race Equalities Commission, the Health and Wellbeing Strategy, and our Climate and Emergency Strategy. So, and what we've done for today is had a look at how we think this links to the health and wellbeing strategy, and we've put out where the themes link. So we feel that this approach can strengthen local voices, because what we'll be asking applicants to do and the council to do is understand what's needed in each town. What do residents actually want? It makes improve social cohesion and connection, because if you've got the amenities locally, then you meet the same local people, you build those trust and relationships and social capital, and it can reduce stress. And then in terms of systems and structures, we make sure people are not left behind, that we meet all those different needs, we understand the different vulnerabilities in an area. And then in terms of health and well-being, green space, active travel, improvements to air quality, all of that should be encompassed in our 20-minute approach. And then in terms of what we value, as kind of mentioned, we're looking at delivering healthy communities, fostering that safety, that physical connection, equality, sane and sustainable places.
In terms of the approach and the audience for this, the kind of primary audience was any investor or developer who is looking to make a development in the borough, but also council's own regeneration projects. And in terms of setting out the approach, it is meant to be a practical tool, practical guidance for anyone not repeating what's in the planning policy. And the principles are very much behind kind of, the example is how this also helps and supports local economies. There is a proven kind of evidence in terms of local amenities, encourage more spend in the local area within the local economies. Also, it overall, in terms of providing those amenities on people's doorstep, would mean we will be saving money the council will be saving money in the long term. The approach is we are using 5 pillars to this approach of applying 20-minute neighborhood thinking to an area, and also just to sort of rule out some of the I think there was initial impression was this is how does this relate to, does it restrict movement? So it was very clear in all of the work we did was this is not about limiting people's movement and choice of freedom of movement, but this was more about what's within your local walking or active travel kind of distances from where you live. Those 5 pillars are kind of in a way that this needs to be community driven, so engage with communities. We also need to underpin any of the, rather than anecdotal, put this into data context of applying the GIS tools or council's own data sets. We have multiple data sets, embedding into data sets. The third one is it's not solely the council who is able to deliver these strategies. This needs to be a partnership work between council and private sector, and also the third sector and kind of health and other agencies we work with. An integrated approach was another key pillar. We did so. The guidance is a summary, but underpinning this guidance is our town-specific 20-minute neighborhood studies for each town, which were produced from 23 and 24. Last 2 years, we have been working on these at town level. When we produced our 7 towns document internally through Officers Working Group, it was important that we, rather than applying planning or developer lens, we apply a resident lens, and we undertook a number of mapping journeys of different residents and different profiles. So if you're a young person, what would be your expectations? If you're an elderly looking to go for a hospital appointment, or a family with child. So user journeys are really important. And if anyone applies these principles using these different lenses, this would also result in much more holistic thinking. In a simple terms, the journey will be establishing the baseline of a big site or a big development regeneration planned in, say, a town of Ealing. You would be establishing existing baseline. Then is to understand it from user perspective. So engagement is really important. And then going on the journey of refinement and revision. And this is really important because what often the kind of an outsider view of a place is quite different from how residents see it and what's the priority for them. In terms of practical steps, the guidance is again is quite succinct, but it sets out top 3 priorities for each town. 7 towns, each town has got priorities, and they are not set in stone. So this was those priorities were based on engagement council undertook during 23-24, but those priorities will change and evolve. So the plan is that we keep this document live. It will be updated in every few years. And now the work of Your Voice, Your Town is evolving. Your Voice, Your Town will also feed into this in terms of the top priorities for each towns. I'm giving an example of Southall. There is a similar chart diagram for each of the towns, but for Southall, these 4 top priorities identified through the engagement work was, the development is happening, but perhaps community and health facilities in the localities are not keeping up with the increase in residents' needs. So that was one. The second one was there are large open spaces and green spaces, but lack of or limited provision of smaller or local parks and open spaces of high quality within the neighborhoods of Southall. The lack of the third one is the kind of street environment and public transport availability, and very lastly was places to work. So we are seeing high level of quite a good number of residential provision, but if you're trying to work from home or work within the area, there is no provision of affordable workspace. So this is an example, and this would give any developer or investor a starting point to understand where the communities are. In terms of delivery of this concept, it will be a partnership working, and some of the principles are working with the community in planning these developments, looking at social value in its broadest sense, and also actual physical infrastructure delivery. This will be some of this could be funded through council's planning function of community infrastructure levy or section 106. But in the long term, it's also possible to work with private sector to deliver these projects. I've included examples, the pictures of South Acton Gardens development, which is quite a successful example of a number of years of efforts working with the private sector partners, council's housing team, and also community, where some of the essential community facilities were delivered, implemented in first early phases of the project, and that is leading to more successful and holistic neighborhoods. Thank you.
Great, thank you very much. Thank you for the introduction. Anna.
Thank you both. That's really helpful to see, and I think for this board especially to kind of really see that alignment with taking forward the health and wellbeing strategy. It feels like a really great positive alignment. I think it's also really good to see the links there. I know when we met recently in a meeting around this, around actually building on what's already there. So it's, you know, and with Let's Go Southall, there's a great example in there as well, and also working with our private sector partners around this. So if people are coming in to work with us locally, actually these are the approaches that we can take, link them up with existing infrastructure, etc. So I think it's a great example in there. And I think for us, it's really just thinking about that 7 towns level, how our officers across the council, across CVS, NHS partners, etc., kind of know about this, really share that approach within their work, and really think about that very hyper localized approach. Thanks.
Thank you. Thank you for the presentation. Oh, I beg your pardon. Beg your pardon. Sorry.
Thank you. So we recommend the integration of public health with urban planning. It's a great example of taking a wider approach to health and well-being, and the diversity of engagement that was undertaken during this process, Your Voice, Your Town, and the vision of inclusive tenure-blind development are also encouraging. We just want to ask, how will the council continue to engage groups on the subject that are harder to reach? Carers, new residents, migrants, disabled residents, in shaping town priorities? And what metrics will be used to assess whether the 20-minute neighbourhood concept is reducing health inequalities?
Jennifer, Amanda, do you want to pick that one up?
So from a planning point of view, obviously communities are consulted on planning applications, but also through the development of planning policy. And also we have our community development panel. So when new schemes come to us as part of the planning process, then if they're of a certain size, they go to that panel that has a selection of people from all the different areas of Ealing to kind of give that more community level view. But obviously that's only a small selection of people. So then I think it's kind of a lot with the work that we're doing with Your Voice, Your Town. And I don't know if Amanda wants to come in on that a little bit.
I think it's quite early days for Your Voice, Your Town. Only first round of meetings happened and the town teams will be formed, but we expect that group, because it's a now much more refreshed, broader, inclusive forum, they would act as the initial sounding board for any new investment and developments. But that's only, again, a sample. So again, the emphasis here in this document is to engage, and in some cases, this responsibility will be for the council. When council is leading on a project, but if it's a private sector, we'll be asking them to undertake thorough and detailed engagement. But I agree, this is not going to be, this is only the beginning, and we'll need to ensure that this approach is applied and kept alive, and information is up to date, updated regularly.
Kerry, did you want to come in?
Yeah, thank you, Chair. In responses to David's question, we've had discussions very recently with myself and Jen and her team, and to linking the planning and development function with the co-production boards that sit within adult social care to ensure that there's a voice of the groups that you're describing, David, and supporting Mandar and colleagues here, people who use wheelchairs, carers, neurodiverse individuals, and the impacts of the changes on their situation. So we're developing that piece, and I think that's going to be a really exciting area of development for us organisationally, to hear those voices within this planning and development space.
Okay, Councillor Steed.
Thank you. Yeah, thanks for the presentation. And I guess the concept of we're calling it here 20-minute towns, whatever, localism, digging deep and everything is great, and very much in tune with principles that we say some of us have anyway. How does You mentioned the South Acton estate, and I can see what you're getting at there. Absolutely, the some medical facilities that are in place there comparatively recently. How does one go beyond those sort of little hubs, if you like? Does one accept you're going to have areas that may not really sort of fit into this? They're just not going to have enough, I don't know, facilities, be it shops, be it provision of services. How do you get everybody involved, basically, in having in signing up for this? Do you see what I mean?
Yeah, I mean, I guess the concept of the kind of 20-minute sort of radius is the idea that you would be able to, even if it's not directly on your doorstep, you'd be able to travel either walking or cycling to those amenities. But you're right, there'll be some amenities that you won't have in it. You won't have a swimming pool in every town, for example. Yeah, sadly. So we'll have to look at what's kind of what's the priorities for each area, and that's also where your town, your voice comes into it. But also, I guess where this is kind of slightly new thinking in a way is thinking much more around those social amenities, even just kind of shops and open space, in a way that is absolutely fundamental to good development. I think sometimes schemes are seen in isolation and not necessarily what they bring to the wider area. And this is trying to get that thinking a bit more around, well, if a developer's coming in, they've got a site, then they can have a think about, getting the views of the community about what could they do that would meet a gap. And it won't always be everything in every area, but making sure those key priority amenities are provided where they can be.
Okay. Do I need that? I don't know. Maybe I do. Okay. All right. Going forward then, I mean, lots of sort of local initiatives. I can think of local websites, for example, where they list local services and whatever, and they very rapidly go out of date, and you find various businesses no longer exist. So there would obviously need to be an ongoing attempt to make sure that the information and the links are updated all the time and stuff.
Yeah, and that's true, and that's one of the kind of, when we were doing this piece of work, we found that exact thing quite frustrating, is that there isn't a kind of a bank of information that's constantly updated. But that's why some of the onus is putting on the people who are actually coming in to do the development, to actually find out and understand that. We can share the information we have, so there are kind of different data sets that are kind of updated, but being very particular, one of the issues we have through planning, for example, is that Class E is a very flexible use. So that means if someone gets a permission for that use class, they could do a gym, they could do a shop, they could do a whole range of things. It might change from month to month. So there'll never be a static, there will never be an understanding exactly of what's there and what's needed. But as long as we've got a bit of an understanding of what, how places are changing, and we're working on finding where that information, how we can assess that and monitor it as far as possible. And there are, as I say, there's the GLA High Streets data set, for example, that we can tap into.
Okay, thank you very much. Any more points or questions on this item?
Hi, thank you, Chair. Just to break the habit of a lifetime, I'm vaguely in support of this trend towards neighborhoods and strengthening the infrastructure. And I speak as the ex-deputy head of the decentralization unit in the late 1980s and 1990s. So just another hint to give away my age. But anyway, our question is a plea for more inclusion, I think. And in the question, and in speaking with people with disabilities, they do feel a bit excluded in terms of this report. They feel that there's an emphasis on walking and cycling to local shops, GP surgeries and leisure facilities. And some people, elderly or those with disabilities, are unable to walk even short distances, and certainly can't cycle. And they want a much more varied everyday life as well, really. They want to attend their appointments at Ealing Hospital or other local hospitals. They want to be able to visit friends or neighbours and or relatives who are in care homes who might be outside their neighbourhood. And basically, they need the use of a car or a taxi, especially if they're a wheelchair user and they're going longer distances. And so they need easy access to parking arrangements of various sorts. So in view of these concerns, our group is calling for a disability equality impact assessment to be carried out at an early stage before further decisions are taken on these proposals. And again, I'm calling really for more inclusion, perhaps to have more consultations with people with disabilities and people with some problems with traveling. Thanks.
Yeah, thank you very much for the contribution. I'm just sort of cautious of what this document is in the context of what it sets out and maybe the language. So I certainly appreciate that the discussion of walking and cycling might feel exclusionary in the context of people with disabilities. I don't think that's the intention of the report in terms of what it sets out to do. So this isn't a prescriptive menu of choices that the council will have to take key decisions on that will determine what goes where. It's a framework of thinking to try and make sure that when we have discussions with developers and as a public sector, we are thinking laterally about what constitutes a good community. And I know to some extent 20-minute neighbourhoods, 15-minute cities have been the subject of some quite pernicious alt-right sort of conspiracy theories that sort of suggest that somehow a dull planning concept of people walking out of their front door or cycling to the local shops is somehow a recipe for locking people within community. I mean, it's just some of the stuff that's on social media I think is absolutely shockingly bizarre and amplified by people with incredible power. I think we need to be really clear. We're not speaking about parking. We're not speaking about travel. We're not speaking about restrictions on roads. For those people who need to access vital services and community facilities using motorised vehicles, that will always be the case, and we're always going to want to support and enable that. That's absolutely true. I think what the piece of work is trying to do is reflect that, say for example, when a site comes up that's in the middle of Southall that's surrounded by tall buildings and lots of concrete, and we've got a choice about what we do with it, and do we simply acquiesce and decide that we're going to put up more flats, or do we say, well, actually, this particular area of Southall could well do with some access to green open space, and that might be more important and valuable in the context of the discussion and the framework that we're having now than necessarily acquiescing to what a developer might want to do. I think we've just got to be very clear that the net consequence of the work to understand our towns isn't going to result in decisions stemming from this paper that says X or Y must happen. I think it's more a reflective piece on how on a sort of how we think about the borough as a whole. Councillor Newstead, did you want to come in?
Yeah, I think that's absolutely right, and thank you, Chair, for being explicit on the specificity. In essence, it's something that sets the tone for how we want to engage with potential developers, but more importantly, how we want communities and our residents and all of them. And David helpfully raised the issue of making sure that is inclusive. All of our residents participating in that, rather than feeling that developers come in and we have relatively few levers which to ensure local needs are met. It is also worth noting, and I know that you and I and others within your organisations have had this conversation, and it's slightly off piece for here. There is nothing in our ambitions to be a cleaner, greener borough with more people walking, cycling, wheeling, and less dependency on cars and people using their cars less in our active travel agenda that is anyway intended to exclude those who have disabilities or who might need their car to access things. I think for all of us, cleaner air and a healthier public realm where we can access and do the things that we love to do is good for all of us. And there is certainly nothing at all. But I would be, as I've said before, happy to have conversations about how we make that more explicit in the way that we think about things and the way we talk about our ambitions, whether it's in climate action or our travel agenda or in our planning space, to be more explicit about our intentions to be inclusive and to make sure we're including everyone's needs.
Okay, thank you very much. Unless there's anything else on this, what I'm going to propose, are we ready to go back one agenda item to, where are we? On my list, the integrated neighbourhood teams.
Councillor Mason, apologies for being a minute or two late and not therefore being able to pass on apologies from Neha Unadkat, who has indisposed and unable to join today. I'd be happy to speak to the integrated neighbourhood teams item if helpful. The second item that's related is about primary care access, and due to Neha's indisposition, I wondered if it would be worth us deferring the primary care access item for a future meeting when we can have ICB and primary care representation.
Yeah, I mean, I'm happy to do that. I see sort of nods in the room. Unless there's any objections, that's what we'll do. So are we saying, so which item are we?
So I'll speak briefly, if helpful, to the integrated neighbourhood teams
6,
piece.
fine. Okay, go for it.
Okay. So without wishing to talk through the full slide pack, which is attached in the pack, I think it's really helpful to have the integrated neighbourhood teams item following the discussion we've just had about the 20-minute agenda within the borough, because I do think they're intrinsically related to how health and care is seeking to extend the work that we've been doing through our primary care networks to develop a local and neighbourhood-based approach to the delivery of health and care. So within the pack, you can see that there is a summary of the broad agenda that North West London as an integrated care board is pursuing, which is entirely consistent with our understanding of the national recommendation to move towards a neighbourhood NHS, aligning a whole range of services wrapped around how primary care is configured. And the services that might be included in that will also be those delivered by my organisation, West London Trust, delivering community mental health and community health services to residents within Ealing, and trying to take a more joined up and a more integrated approach to the delivery of those health and care services. There are various buzzwords that you'll see that appear through the pack, including having no wrong door, but also trying to think about the needs of the local populations within those neighbourhoods, and perhaps take a more proactive approach. So to date, we've been having a similar conversation to that of the 7 towns and the 20-minute agenda, trying to get the geographies right and which of our services can wrap around whilst being sustainable those communities. We had within health been working on 3 localities, which broadly speaking are the North, the Southall area, and then Ealing and Acton. And within them, there are the primary care networks with which the Health and Wellbeing boards will be familiar. And those 3 integrated neighbourhood team localities have been forming over the last 12 months to develop a relationship, to extend that which is delivered within primary care, but also to pick some priorities for their communities. So there is a slide entitled Neighbourhood Working in Action, which highlights a number of the projects that these teams have been working on, including looking at what are described as high intensity users, individuals who use a number of health services, including unplanned care, the development of child health hubs, trying to work, including with the voluntary sector and secondary care, around improving the support that's provided around mental health, improving care navigation, some preventative work, including increasing physical activity, and very good work, particularly in the Greenwell PCN, piloting integration with substance misuse services commissioned by the council, and you can see a number of the other examples. We are obviously mindful of the need to align with the town's agenda within Ealing, and also to try and make sure that our neighbourhoods are at an optimal size. So we're currently transitioning from having those 3 localities to work in smaller chunks where at all possible. So we're trying to split those down to be much more in that smaller neighbourhood, the population of 50, 60,000 residents, similar to our primary care networks, and we're working to map those onto the 7 towns agenda. And you can see on the slide described phase 1 how we are linking primary care, community mental health, but also public health and local authority teams to build those integrated communication networks to try and join up the services that are being provided. The initial function slide, which in my pack is on page 15, describes the priority areas, and we've picked groups that we think will most benefit from an integrated approach. So individuals who might broadly be defined as experiencing frailty, needing multiple touch points with health and care services, a group of individuals who are working age adults but with other complexity such as mental health or substance misuse, and then the work that we've been doing very closely aligned with the local authority around the children's health hubs. On either side of that, you've got the prevention stuff, looking at population health and some very specific communities. And on the far right of that, you can see how this links into the work that we're doing across the borough on urgent and emergency care access, including linking in with our local hospitals and with the ambulance service. So really, I think the key update is the work continues. I think it's really closely aligned with the conversation we've just had about making sure that care is provided as close to home as possible, and is trying to do that shift towards being more preventative wherever we can. We've put in a whole range of work streams which colleagues from across the health and wellbeing community in Ealing are collaborating on. Some of it's around making sure that we've got a One Public Estate agenda. We're using our workforce and trying to reduce duplication. We're trying to bring in digital solutions to improve efficiency and productivity, as well as working with our communities and making sure that we've got clinical pathways that link into secondary care. I'm happy to do my best at answering any other questions if that's helpful.
Thank you, Chris. It sounds like what I've heard Neha say before, so that's good. No, it was really just for this board to be aware this is an ongoing conversation over the last 2 or 3 years, and it feels really woven into the council work as well. So not just kind of the teams and directorates sat here, but including our strategy and change, planning, transformation teams, which I think is really helpful. I think we're having the same conversations. I think the one thing I'd just say for this board is this feels really complementary to the kind of wider community work. This is partially or mostly in terms of wraparound individuals and their care needs and their health needs, with the bits around the edge which are very much kind of more of the council or some of the council side in terms of what does that look like across the community, how do people link together, how do we connect communities, what's that real prevention end look like before people even get to care or even know about it, and especially with the real inequalities around homelessness, no recourse to public funds, etc. So I think it's really complementary, and I think it's just us thinking about it all as kind of one general approach, and carrying on with that work. So I think for me it's just really suggesting this kind of comes back to the board on a regularish basis in whatever format it looks like at the time. And I think obviously thinking about the NHS context going through the next few months in that and how we can support as a partnership here. Thank you.
Thank you, and thank you, Chris. I'm glad to see that you listen to our colleagues. Neha. I think Anna's point with regard to the current situation within the NHS, both locally and nationally, is going to be really influential within this space. Local government's all about local, and I think working with our partners in this space has been really important within the system of Ealing. We've got very strong relationships with NHS partners in this space, but I can see those relationships come under pressure in the coming months and potentially years as structures move and there's changes made. The importance of keeping this board informed, the scrutiny board committee informed, and working through the processes and keeping those strong engagement and communication is going to be really key to ensuring the success of this, because there's going to be financial challenges and risks to partners within this space that we need to keep aware of.
Yeah, I mean, just to reiterate that, I mean, I think it's great work and very much aligns with what we want to be doing. We want to go further and deeper into these kinds of work. It clearly, a plea is that we don't all retreat to our safe spaces in the coming months as things get difficult. And I think, we have certainly at a borough level developed significantly strong relationships that mean that shouldn't be a risk. I do still think there's a question around what we all mean by prevention. Oh, no one needs to hear that 3 times. But so I think and we appreciate that there are challenges at the moment in terms of headspace and time, but there's going to need to be an assessment of what we all mean and how we can both most usefully contribute to essentially keeping people out of your services.
Yeah, David, and then Councillor Steed.
Yeah, we want to follow up on that. We think that the ambition and clarity around creating 8 neighbourhood teams is very proactive and exciting commitment to genuine person-centred localised care. And we also like the approach that the model includes public health, voluntary sector and primary care under one framework. The no wrong front door principle is great. Our questions, and if these are more appropriate for Neha, at least we can get to them later. How will local residents be informed and reassured about changes to the teams that they're used to accessing? What opportunities will local people have to co-design and give feedback on how the neighbourhood teams are developing? And how will the new teams ensure continuity of care, especially for vulnerable groups navigating complex pathways?
I'm happy to come back on a couple of points if I may, and I'll try to respond to yours as well. I think it is going to be a challenging year for colleagues in the NHS, as is in other parts of the public sector. I think one of the things that's really strong here in Ealing is the relationship that we have and I'm wearing my provider hat, as a provider of services here, and West London Trust, and I know colleagues from London North West would probably say the same. Whilst we will have our challenges, I think we will be doing our best not to lose momentum in this space, and I think that the aspirations of developing a neighbourhood NHS that enables us to do that left shift from treatment to prevention and to shift care where it's appropriate, closer to home, will also help us to, we hope, unravel some of the other challenges that are being experienced further down the system. I think, and certainly it's a commitment from West London Trust, and I'm sure from the other providers that work in the borough, to not lose that momentum here. Which is why I'm quite glad that what I say is similar to what Neha has also articulated in other forums. I think the one thing I would wish to reassure residents is that I think this is an evolution at this stage of work that we have been articulating for some time. So we're not intending to introduce anything that is, and there are different pilots in different parts of the borough, so we're not intending to introduce anything that introduces variation for residents within Ealing that is unwarranted. We're certainly keen to use the partnership working and the integration and communication between different parts of our system to actually hopefully enhance access and capacity within the services that are available, rather than to totally reinvent the service offer for our local residents. And I hope that is reassuring. I think the point that you make about both informing and engaging and co-producing with residents is one that can never be made enough, and we need to listen more to, and certainly something that I'll feed back into the work. We are using the avenues that we have, including through some of the local authority channels and forums, to to solicit feedback about what is and isn't working, but we'd be very keen to work with Healthwatch and also through our participation groups and our parent and carer forums, etc., to make sure that we've got this is being robustly tested and co-designed and co-delivered in some cases as we continue to evolve it. But I'll feed that back to the working groups.
I think actually you've answered to some extent the question I was going to come up with, but so this is gradually evolving now, and will go on. There's no like sort of big bang day where it's all going to suddenly bright new world, whatever.
I think the answer to that's probably no. So we've had for some time our primary care practices cooperating more and more, and we've wrapped a whole range of additional roles to kind of help make primary care work better. What I'm trying to do within the community space is make sure that my teams work in a more seamless way with those primary care networks, and I think this is that. So unless others think otherwise, I don't think there will be this is being suddenly launched and you'll notice a radical difference on X date in the next few months. But I would hope that by the end of next year, we'll be able to report back to this committee. We believe we've achieved the following things by improving capacity, improving communication, reducing duplication, etc.
Don't see any other indications on that basis. Thank you very much. And we move now to item number 8, the CQC and the LGA review learning. Who's leading on this? And by all means, of course, yeah. Go for it, Kerry. Yeah.
Thank you, Chair. So this is to provide the board an update with regard to the outcomes of the CQC inspection, which was in place in Ealing in July 24. And further, the LGA review of our peer review programme, which had initially been completed in January of 24 and then was reviewed again in December. The report includes the documents that have been shared by both CQC and the LGA. And the more eagle-eyed review will note that there's quite a significant variation in terms of the perspectives on the services provided in the Borough of Ealing through the Adult Social Care Service. These reports have been through the HASP process, and we have a programme of work to update the scrutiny committee with regard to the performance and progress against the targets and lessons learned that have been taken from both the CQC report and from the LGA programme of work that we've completed with them. We already have a extant work plan for 25-26, which is responding to the learning from both reports and bringing the report here for information in essence and questions.
Okay, thank you. Any indications?
So it is, from our point of view, very encouraging to see Ealing using both the CQC and LGA reviews constructively, especially with improvements in assessments, co-production and reduction in waiting times. Implementation of magic notes and the emphasis on strengths-based working are fantastic innovations. It's clear the borough is investing in better experiences with both staff and service users. And the commitment, I believe this very strongly, to culturally competent care and strong partnership working across the system deserves recognition. Our questions are, how will service users and carers be kept informed about the improvements already underway, especially for those waiting for support? And are there plans to showcase positive stories from carers and residents as part of rebuilding trust of them following the CQC review?
Thank you, David. That's really helpful questions. In terms of how we're sharing information with local people with regard to the work plans we have in place, we have a newsletter which goes out to 6,000 people who use services or are known carers, and we're promoting the good works, but also sharing information about where we've experienced challenges and how we're improving against those challenges. Councillor Newstub and Anna and myself were just in a meeting with our media press department leads, and we've got a clear programme of work that talks about the positive stories that we're hearing. It's an interesting point you raised with regard to a loss of trust with local residents as a result of the CQC programme of work. It's certainly something.
So we just do have an open microphone online. So if you are online, if you could just please make sure your mic's on mute. Thank you.
I'm certainly not hearing through our co-production boards for our engagement with local people that there is a loss of trust or concern with regard to the product of the CQC report specifically. I think people are aware of the large levels of press interest that there was last summer with regard to the failings of the organisation at that point in time. I understand there's been some significant improvements since then, but it's certainly not something that I'm perceiving. But we're continually working closely with the local community and trying to ensure that they've got the relevant information to see how we're improving outcomes.
Councillor Newstub.
Sorry.
Thank you, David. It's really supportive word. I mean, it's something I've been particularly keen on, is that people don't talk about adult social care in very positive terms anyway. It's always about the problems. And I would say that my experience of going around the borough and meeting residents who draw on care and all of the different organisations that operate within in the borough, there's an awful lot of good news stories, an awful lot of joy, an awful lot of people being able to live independent lives that they wouldn't otherwise be. So I'm very keen that we look to that joy and we find that and we amplify those stories, because I think that's kind of it's good for all of us to not operate in a sort of climate of kind of fear, and to be hopeful and optimistic about what you know, an enriched and long and happy life can be. So I'm very keen that we, particularly within adult social care, but all of the aspects of what we do, that we are, as I said, amplifying those stories, regardless of what reports say our services are. So it's on the agenda in any case.
Just to add one of the items, if that's okay, Chair, the recent resident survey saw a significant improvement in satisfaction levels with adult social care services for residents of the borough. So that's really heartening. That's why we're here, because we want people to have high levels of satisfaction with our services, not necessarily just to get good CQC reports. So that's our priority.
Okay, any more indications?
Yeah, again, I welcome this report, and obviously leaving aside the strange anomaly of the odd contradictions between the two reports, really, the LGA report, which was positive, and the CQC report, which was anything but. But as I said, moving on, but from that, I think we wanted to ask some specific questions about the what the LGA report mentions as a gap in specialist provision and management plans in terms of specialist provision in dementia care, and management plans to reduce the gaps. And so could we have more details of what these plans are to reduce gaps, especially around, does it include an enhanced role for the Michael Flanders Day Centre, which is our only centre for supporting people living with dementia and their carers? Shall I go on to the other question as well? Yep. And again, the other question is the LGA report mentions telephone delays and blockages for people seeking social care and advice and assessment. And obviously, as mentioned, this causes anxiety and stress for already stressed callers, as well as dropouts from seeking early intervention that could cause life and death emergencies later. Measures that have been mentioned include more digital self-assessment and call handling tools are being put forward as ways of dealing with these difficulties. And just to ask and hope that there are also measures to ensure prompt responses and smooth pathways to advice and information for those callers not able to use digital platforms and solutions.
Thank you, Roy. Thank you for your, as ever, for the questions from yourself and from Erskag. In terms of the specific reference to dementia services and supporting people with dementia-like type illnesses and their families, in Ealing we've been working very closely within the partnership to improve the offer within the borough. We opened an additional 15-bedded residential unit last year, which Councillor Newstub and I visited just after Christmas, I think it was. So it's a complete refit. The service has been developed in a way that reflects the needs of people with dementia type illnesses. The service is almost full now, so it's significantly increased the capacity in the borough for people to remain in borough rather than having to move out of borough to access specialist services. It's also supported NHS partners in terms of supporting the flow. We've also been working very closely with our colleagues in the NHS with regard to the CHILLS service, which I can never remember what it stands for.
Care Home In Reach and Liaison.
Thank you very much, Dr. Hilton. That's very, very helpful. Which I think is a really leading service, certainly in North West London, of specialist clinical support within care homes to enable the staff there, but also the residents who may be experiencing challenges due to dementia type illnesses to remain within that care setting, not to be readmitted to hospital, and to support the staff within the scheme to have better skills to respond to needs of people with dementia type illnesses. We've also continued to drive forward on our training within the provider sector and internally for council staff with regard to dementia training. So there's a lot of work, and we also work very closely with the carers sector and our partners in the carers centre and elsewhere with regard to support to carers. In terms of the Michael Flanders service that you've mentioned, Roy, we're really excited about the opportunity that the Better Days programme is bringing to residents of the Borough of Ealing to move from what is a good service that we provide at Michael Flanders, but we do need to recognise that some individuals are on the bus for up to an hour each way to get to the service, and also that the service is based in Acton and it's not the biggest draw of demand within the borough for people to use the services. And we have a plan, and we will be implementing plans following decisions next week at the council's cabinet meeting to have much more locally available services that are reflective of the needs of the community, to provide a monolithic one service provision to a borough as diverse as Ealing is not responsive to the needs of the community. We want to see more people with dementia from all the communities that we serve supported in their own communities and accessing community resources, and we think this is the way forward. The financial case for this stacks up. The more people that we can support to access these reflective services in the community means more people stay in their homes, stay with their families, rather than being supported in more expensive care home placements. Shall I take a breather there before I move on to the next question, in case there's any other questions, Chair, on that specific dementia piece? Straight on. That was a very quick breath. In terms of the point with regard to the access to information and advice within the council, and I think this is the one of the two areas that I think took some real learning from the CQC report. There has been a targeted programme of work in place since November last year, where we're reviewing our access routes. I think David mentioned earlier we're using technology to support our staff to be more effective and efficient in terms of processing their work, to give them more time to spend actually speaking to people. As a result of this, we've seen a significant improvement in terms of initial assessments completed within the first 10 days of contact, which has gone up from 37% to 67% in a period of just over 6 months, which is really positive. We're continuing to review our processes to support an in-person telephone response for people. So where people can, I hate the term channel shift, we support people to channel shift when they can channel shift using digital routes. But we need to be, and we are focusing more resources in terms of the telephone response, but also we're looking in line with the integrated network teams, as Dr. Hilton was talking through earlier, and also Jen and Mandar, in terms of 20-minute communities, to have a more locally focused adult social care offer as well to support individuals in the communities where they live.
Thanks, Kerry, and that's brilliant. I think, looking at that, the waiting lists being reduced so significantly, so quickly, is a real testament to Kerry and the team and the work they've been doing in the perhaps more prosaic operational space to make sure things are working more effectively. I do really think that a lot of and channel shift is terrible. Don't use it. Don't use it. I think those, there are always going to be people for whom a digital response is not appropriate. The more people who are comfortable with that we can have using that approach it will free up more resource and opportunity for other people to be managed more effectively. And I would sort of draw attention as well to our wider borough frontline work, which is about how we show up in people's lives and how we engage with people, and how we can be much better and more effective at signposting people, giving them the advice and support they need in a timely way before they get to the point of crisis. And obviously we know increasingly, and particularly with adult social care, we can only deliver in many cases, unfortunately, that which is statutory, and that at the moment looks to be with us and will continue. So the more that we can do before people get to that space to make sure they're getting the resources that are available to help them stay independent, and that can be done in a timely way that reduces that anxiety and concern, the better. It's excellent for the residents, and it's also good for those who are in the greatest need to get the help that they need.
Thank you very much. Any more comments or questions on this item? If not, then we shall move to the item number 9, JSNA Work and Health.
Thank you, Chair. I'll just introduce this briefly and then hand over to Mona from our public health team. So we bring all of our deep dive needs assessments here for the board to really learn, be aware, see what the findings are, reflect on that partnership working and think about the recommendations going forward and how this board wants to be involved. So Moan has been leading a piece of work on work and health, something we tried to pick up just before COVID hit. So it's been great to kind of push it forward over last year. Moan is going to talk us through the key findings and next steps in a minute. And as you can imagine, there's an awful lot of a wide breadth of partners involved in this, which I think has been one of the best parts of the process, actually, is really bringing those people together and really thinking about this cross-cutting issue. It's a real key stream in terms of our building blocks of health and the health and wellbeing strategy, so it's great for the board to see this. So I'll hand over to Mona. The slides are already up magically. Thank you, Zaina. And then very happy to take any questions at the end. Thank you.
Thank you very much, Anna. So as Anna mentioned earlier, the purpose of me coming to today's meeting is just to give a quick overview of the Work and Health JSNA. The JSNA did start off in 2019 by my colleague Georgia. However, due to COVID, we were unable to publish, so I was tasked with updating this and just rewriting parts of it. So I thought I'd just quickly go through the document just so you can see. So as you all know, healthy work is fundamental building blocks of health. It operates as a root cause analysis of many health inequalities and differences in the health status of different groups of people. Now, being in good employment is both protective for health and can nurture good health. Whereas with unemployment, it contributes to poor health outcomes. So therefore, it's very important to get people into work for us as well. Now, the effects of unemployment or poor work are not just felt by the person themselves, but also by family members and the wider community as well. Now, studies show that children growing up in a workless household are twice as likely to fail at stages of education compared with children growing up in working families. But having a job isn't the most important thing. Good work is very important, and good work means having a real living wage, job security, having opportunities for in-work development, and for flexibility in terms of work-life balance. Now, this is all very important, and making sure that once people are in work, we provide that environment for them to flourish as well is very important. Now, as I mentioned earlier, this work and Health JSNA focuses on Ealing residents. It looks at children's education outcomes. How can we give them a better chance into employment? It looks at the employed population, but also the unemployed population as well. Just quickly going through the contents of the JSNA. I'm not going to go through it in great detail because I think the document has been sent ahead as well. So the first section looks at the background, and it looks at the links between work and health, but it also takes into consideration with the national strategies we have with the council strategies. It looks at the jobs and skills strategy that we have at Ealing Council as well. The second part was our data chapter. Now, with this looks at key themed data chapters. It focuses on, as I mentioned earlier, children, their education outcomes. It looks at sickness absence. It looks at employed population, but also the unemployed population as well. Then the third section focuses mainly on evidence of best practice. So this looks at what works nationally, but also what are we doing in Ealing as well. Section 4 looks at Ealing and external services. So as Ealing Council, what services are available for individuals who are seeking assistance and help in work? And then we also focus on the external organisations as well. You know, what services are available for individuals seeking help. The fifth part looked at potential gaps and future needs within Ealing, and the purpose of this was to help form the recommendations. The last part, section 6, looks at potential recommendations we could implement. Now, with these recommendations, these were actually as a result of a workshop we held. The draft was circulated across, so this has been done alongside various different stakeholders as well. Oh, sorry. Seem to be moving slide. Sorry. So what I wanted to quickly do was just go through some key findings which were found from the JSNA. And now we've divided it into 3 sections. So we look at children's education outcomes. So what we found was that children in care in Ealing perform significantly worse than other children children in care. In 21-22, the average attainment score of 8, which is a GCSE score, was 24.2, which is higher than the national average of 20.3, but it's actually lower than our Ealing population. Pupils with special education needs in Ealing have a higher rate of not sustaining employment, education or training compared to the averages in London and in England. Looking at adult learning, we found that ethnic minorities and economically disadvantaged groups are underrepresented in higher level qualifications and career pathways as well. In terms of the employment aspect, we found that employment rates by ethnicity in London show higher rates for white and Indian heritage groups and lower rates for Pakistani and Bangladeshi, as well as black groups, which reflects the national trend that we saw. Only 1.8% of the working age adults in Ealing with learning disabilities were in paid employment in 21-22, which is much lower than the London's average of 5.2. Now, Ealing residents have relatively high rates of sickness absence. Now, in terms of the sickness absence, there were particularly in terms of the sickness absence, there were musculoskeletal and mental health conditions. Also, half of the ESA claimants in Ealing, 47%, cited mental health conditions as a reason for their claim. Also, the median weekly earning in Ealing was £623 in 23, which is higher than the national average of 577, but also lower than London of 683% as well. Now, as I mentioned earlier, we did look at evidence of best practice, but again, the details are in the document. I'm not going to go through all of these as well, but these are things which help people get into employment and also sustain employment as well. I'll just go to my next slide. As I mentioned earlier, we did hold a workshop on the 14th of January, and we had various different stakeholders attend. Now, the purpose of this was to get everyone around the table talking to each other, and it was actually a very good opportunity for individuals of various different organisations to learn what others are doing, and also as an opportunity to network. It was also a way to formulate, which I'll go on later on, about a health and action group that we will be looking at formulating. And with this particular workshop, our focus was on employment, adult learning, workplace environment, which looks at how do we make a workplace environment more healthier for people to sustain employment and to reduce sickness absence. And we looked at children and young people as well. I'm just going to go through 7 key recommendations which came out of the workshop. Also, I've presented at various different groups, spoken to people, and these are the key themes which have emerged. Again, further details are in the JSNA. I'm just doing very high level reporting at the moment. So in terms of theme 1, we looked at overcoming barriers to employment. Now, this involves improving access to English language training and digital inclusion, and making sure that we have support services for employment and health. Theme 2 looked at building community and employer partnership. How do we strengthen employer networks and support small, medium enterprises, but also support our voluntary sector organisations to flourish and to grow more as well? Theme 3 looked at how do we improve partnership between employers and school? How do we expand career guidance and provide structured work experience with secondary schools and businesses as well? The 4th theme looked at social value and London living wage. How can we as anchor organisations integrate social value into our procurement practices as well, and promote the adoption of the London living wage? I know with Ealing Council, we are trying to push forward the London living wage at the moment as well. So it's how do we better take that forward as well? And the 5th theme, which I already mentioned, was enhancing workplace environments and health. So previously, we used to have a London Healthy Workplace Award, which was open to all businesses of all sizes. So is it something that we create as Ealing Borough in terms of inviting businesses to become more healthier workplace environments for people as well? Again, you know, this is something we could explore. Theme 6 looked at employment support for the vulnerable groups. How do we expand vocational training, job coaching and tailored employment programs for the disadvantaged communities we have in Ealing? And the last theme was theme 7, the role of anchor institutions. How can we encourage local hiring, skills development and flexible employment policies across different anchor institutions as well? Now, in terms of the next steps, as I mentioned earlier, the draft has been shared with various different groups. We've had feedback, and it's all ready to be published actually in April. Now, following this, we will be establishing a work and health action plan steering group. Now, the purpose of this action group will be to look at the recommendations. What are we prioritising? What can we take forward? How can we make an impact as well? We do have a few individuals who are very keen on being part of the work and health action plan. So we've made sure that in terms of membership, it will be a wide stakeholder group as well. That was it really from myself. Thank you very much. I don't know if anyone had any questions. Thank you.
Thank you very much. Yes, questions. Dr. Hilton.
Thanks, Mona. I think this is a really important piece of work, and I had a very happy to catch up with you outside of the committee about it. But West London Trust is a commissioned provider of individualised placement and support for patients with mental health needs to both retain employment and gain employment. And I think we've got a really important role to play together in addressing some of the findings of this JSNA. So I'd be really keen to make sure that you're linked with the right person in my organisation to make sure that we're helping drive it forward.
Yes, thank you very much. We have had various different people, but we're very happy to get the names for that as well. Thank you.
Yeah, in fact, the Secretary of State for the Department for Work and Pensions was in Hammersmith yesterday. I was able to sort of meet her alongside the leader of Hammersmith and Fulham to talk about the £42 million that's come through the Connect to Work programme, which is very good news for West London, and particularly for the West London Alliance that's done so much work on the Work and Health programme previously. Really to make sure that we're sort of delivering targeted support for particularly adults with long-term musculoskeletal conditions and with enduring mental health issues, to ensure that we are supporting people to be in work, and particularly when they want to be in work. The Secretary of State was able to meet a woman who lives in Paravel, who could tell the story of going to a GP, not quite having been ready for work, but wanting to get to work. And the GP didn't quite know, at that stage didn't really know what support was available to them, but was inquisitive, went away and found social prescribing, and she can now tell the story of being supported well back into work in a right environment that supports her. So this is really important stuff at the edge of a cohort of people that for whom want to work should be able to access employment. And making sure that we've got a clear picture of that is incredibly important in the context of then us working with employers to sort of set out what they need to do actually to create the right environment for people to work. So I think it's got a significant amount of learning. That wasn't in any way, Dr. Hilderson, a critique of GPs. That was not my intention. It might come across as that. Simply an anecdote in what was a great story yesterday that actually really brought to life the impact that these programs can have.
I wasn't going to come back on that point at all. I remembered that we're in a public meeting and was going to shamelessly take the opportunity for the record to say that there are some open access opportunities for individuals who are interested in re-entering the workplace. So any resident of Ealing is welcome to contact the Recovery and Wellbeing College that West London Trust runs, which provides CV guidance and support to help people access employment. And we've also got, both in West London Trust and in some of our NHS partners, a volunteer to career programme for individuals who want to test volunteering as an avenue to building skills to get back into employment. So again, happy to make the links.
Good. Okay. Yeah, go ahead.
I think it's a really helpful report. Thank you very much. And it's just an invitation really for us to look at the work streams, particularly related to children, young people, thinking about how we tie the best practice that we want to seek with the ongoing work of Ealing Learning Partnership, because there's a huge amount of work already underway in that space. And also thinking about the council's leadership in relation to corporate parenting, the work that we're driving for care leavers. It's helpful to demonstrate that we're doing really well when compared to other local authorities in terms of what we deliver for our care leavers, but you're right to highlight that gap between care leavers and children who are not in care. It's a national challenge. Although we're doing well here, I'm incredibly ambitious, as I know that the administration is, that we redouble our efforts and do even more for our care leavers. We have a partnership that's just about to get underway with the Shore Trust that focuses on how we can actually support young people who might have difficulty accessing apprenticeships into work with a form of orientation, such as traineeships, so that when they eventually do get into an apprenticeship, or they do go into study, they have the skills, the know-how and the resilience to stick with it. So really supportive of this, and excited to find new learning from elsewhere that we can apply. So thank you.
Go ahead, yeah, David.
Just to reiterate what everyone else is saying, this is a very important piece of work dedicated on the intersection of work and health. It's crucial for reducing inequalities and supporting long-term well-being. Do you foresee one of the actions the steering group comes up with is ways to support employers in order for them to become more inclusive and health-aware workplaces? Thank you.
Thank you, David, for your question. Yes, definitely. In terms of this work and health, I think it will be a good opportunity to support the employers as well. And again, there are other teams within the council, and I think it's important to bring all the key players around in order to provide that support to the employers as well. Thank you.
Yeah, and you know, there are, I think the latest statistics nationally is there are 3 million people of working age with long-term health conditions that could otherwise be in work. The more interesting, well, not the more interesting, that's the wrong phrase. The other significant challenge here is that there are 4 million people in work with long-term mental and physical health conditions. So, you know, to some extent, this isn't necessarily just a challenge of finding people who are out of employment into work, but also ensuring that we retain people in employment who are at risk of dropping out of the labour market in employment too. And particularly in the context, and especially so in London, where you know the labour market is such that there are significant numbers of vacancies in the labour market with, unfortunately, people either with conditions or skill sets that aren't able to access those roles. The roles of employers are going to be incredibly important to to take risk, to understand the risk profile of what it might mean for them and their business, and actually that there are a plethora of mitigations and there are a plethora of mechanisms and means to ensure that every business in London has the ability to recruit people who can A, do the job, but also B, wants to do the job and have the skill sets to do it. So, you know, this is going to be an emerging piece of work that I know that we're going to want to focus on quite a fair amount, so as is the government's agenda on this area too. So, you know, it's a really timely piece of work to sort of help guide the sort of the next set of actions that we need to take in this space as we sort of get through the next few months and years. So, you know, I really do say thank you for this piece of work. Unless there's anything else on this, we'll say thank you. So noted. And we now move on to perhaps one of the more trickier topics for today, which is the BCF 2005-2006 plan sign-off.
Thank you, Chair. For those of you that are BCF enthusiasts, you will recall that the BCF was due to be signed off by the 31st of March 2025. It sits under the statutory functions of the Chair of the Health and Wellbeing Board to sign off that plan. We received a correspondence from North West London ICB on the 20th of March informing us that there'd be a 50% reduction to the additionality that Ealing Council receives through the BCF funding stream coming to the council. That 50% reduction is a precursor to 100% reduction, which is a £2.6 million reduction in budgets for 26-27. So it's 1.3 for 25-26, 2.6 is our understanding will be the reduction in 26-27, but we're still waiting for confirmation on that. In light of the significant impacts that the late notification of the reduction in funding would have on the council's MTFS financial planning programme, where we'd signed off our budget some 4 or 5 weeks before, I recall, in terms of the pressure that would put on the adult social care budgets and the likelihood that we would have to reduce services or provision of services to the local community, we've taken the decision that we are unable to sign off a plan for 25-26 We are therefore in a process of extension where Ealing Council and its NHS partners locally are in dispute with the ICB. We have a 12-week window to review our position. Thereafter, we have a 12, which would I think take us to July. Thereafter, we go to a 12-week mediation process, and if we're still unable to come to resolution with the ICB, we would move into escalation, which would mean being visited by top officials at NHS England to try to bring us to a point of resolution. As I said earlier, we have very strong partnerships in Ealing, and we've been having a lot of discussions within the Ealing NHS and social care system with regard to these challenges. We're not the only borough in North West London who have been unable to sign off on the BCF. Only 3 of the 8 boroughs have signed off so far. 2 of those are because the financial position was minimal impact. Harrow had 0 impact. Hounslow had minimal impact, and I think Brent have found other ways to manage their financial position, but all other boroughs are currently in a position of not being signed off on the BCF at this stage. So I think from a formal process, and I look to Avtar to nod or shake her head, we're bringing the report here to note that we've not signed off on the plan. You nodding, Avtar? Yes, she's nodding. And that we'll come back at future dates to update you, and I think specifically via you as the chair, Councillor Mason.
Yes, I mean, you know, as you say, this is a statutory function. I occupy as the chair of this board, you know, but I think it is right that we do give the wider board sight of the decision not yet to sign off. So I think it's important that we do at least put that on the table and allow sort of members of the board to note it. Are there any further points, contributions, Dr. Dilton?
Thanks. I guess although I am a member of this board as a West London Trust director, I also have the role as chairing the Borough-Based Partnership Senior Leadership Team, and it's fair to say that we had a extremely constructive conversation about the position that we find ourselves in as health and care together in this space, needing to move forward within the constraints that we are facing, and also to try and understand the impact that that will have for residents of Ealing. Having done a crash course in what the BCF elements are, thanks to Avtar and colleagues, one of the things that I think is causing us the biggest challenge is the way that historically health and care integration in Ealing has been so strong, and that there has been a considerable amount within that discretionary additional element, which isn't the case in the same way across all of the boroughs of North West London. So the potential of a approach that is taken across all 8 boroughs being applied in exactly the same way may have a disproportionate impact for the residents of Ealing. I think Kerry and myself and Nahar are extremely keen to make sure that we have full visibility of that. I know Nahar is doing her very best on behalf of the ICB to minimise the impact and to work through what mitigation she can put in, because ultimately this is about services that are particularly supporting flow in an integrated way through our hospitals and through some of our community services. So it's good that we've bought some time to continue the dialogue and, you know, hopefully reach some conclusion before we get to mediation and whatever comes next.
Yeah, I mean, you know, I wouldn't wish to cast aspersions as to other boroughs within the BCF environment in West London, but you know, the strength of integration and the work that has happened historically over the last few years, I think actually is a real testament to the strength of the relationship between both health and care. You know, it would be, choose my words carefully, I think it would be a shame. It would be a shame that the purpose of the BCF would be sort of mitigated in the current environment without sort of a swift resolution and an equitable resolution for sort of both health and care. So we will keep the situation under monitor and review, and hope that when we get to the end of what will be a long 24-week process, we can resolve it before we have to escalate to the Department for Health. So fine. So you could note it. It is noted. You have that information, and we'll keep you posted when we believe that the situation changes. There are no members of the public left, unless there are any online who wish to ask a question, but I haven't had notification of any that haven't already been asked. So it's for me to then say the meeting is concluded. Thank you everybody for participating. We will see you again on Thursday, the 26th of June. Thank you.